My son, Paul, died of a drug overdose. He struggled all of his life with neurological differences, one of which was a language impairment that compromised his ability to communicate. He was sweet and kind, and he was a happy child. But as he grew, he was marginalized, and he was often bullied, and he began to feel bad about himself. By the time he was in his early 20s, he turned to drugs. At one point, Paul was incarcerated. He was a target because of his vulnerability. He was robbed. He was sexually abused. When he got out, he was despondent. He really felt worse about himself than he ever had before, and his choices were limited. In recent years, we have realized that we need more health care in lieu of punishment, and that has begun to pay off. We can already see a dip in the number of fatalities as a result. But this hope is compromised by laws that are coming up in many states that impose mandatory minimum prison sentences for a person who shares or sells a drug that contains fentanyl. I think about Paul. And despite his hardships, he had grown. By the age of 32, he had a job that he loved, and he had his first apartment. But he relapsed. He used with a friend. I have no idea which one of them secured the drug, but I do know this. Had it been Paul, he would have had no knowledge of any additives, and he certainly would never have had a sinister intent. And had the other person overdosed, the thought of Paul in prison for the better part of his adult life is unbearable for me. In fact, his being deceased is better. Paul's story didn't end well, but God willing, it can shed light on the need for health care that he was refused, that had he gotten, would have saved his life.